Look at your nails right now, not later, right now while you are watching this. Because what I'm about to show you is something most people walk past every single day without understanding what they are looking at. Most people glance at their nails the way they glance at a wall. It is there. It is familiar. There is nothing new to see. And that assumption, that comfortable habit of not looking, is exactly where the problem begins. Your nails are not cosmetics. They are not something to polish or trim and forget about. They are a biological record, a passive, continuous archive of everything that has been happening inside your body for the past 4 to 6 months. And in many cases, they carry the first visible evidence of a serious disease long before any other symptom appears, long before you feel anything, long before any routine blood test would catch it, long before the scan that eventually finds what has been quietly developing for years. I am Dr. Hiroshi Nakamura, and I have been practicing internal medicine and geriatric health for more than 30 years. I have worked with thousands of older adults, many of whom came to me after a diagnosis had already been made. And I have sat with patients whose nail changes arrived before their diagnosis did, before the scan, before the blood test, before the first symptom they could name. The nail found it first, not because I was brilliant, because I looked and I knew what I was looking at. That is what I am going to give you today. Not a list of things to be frightened about. A tool, a way of looking that you can use every month in your own home, in your own time, without any equipment. Because the gap between what your body is telling you and what you are actually receiving as information does not have to be as wide as it is. Before we go further, I want to address something you have almost certainly heard and almost certainly believed. White spots on the nails mean you are low on calcium. I want to be direct with you. That is clinically false. It has been studied and disproven in published dermatology research. Those small white dots are almost always caused by minor trauma to the base of the nail. A small impact, a rough manicure, a moment of pressure you pressed against something and have long since forgotten. The nail matrix, the living tissue at the base of the nail that produces everything you see, took a small disruption. The layers did not form quite correctly in that moment. And 3 to 4 months later, when that section of nail finally grows visible at the surface, the white area appears. By then, the cause is gone. The myth fills in the explanation. I tell you this at the start because it matters. If you have been reading that one harmless signal for years and calling it meaningful, it raises a question worth sitting with. What other signals have you been misreading or missing entirely? The white spot myth is not dangerous on its own, but the habit of incorrect interpretation is. Because when you learn to see one thing incorrectly, you begin to assume you understand the whole system, and the signs that actually matter slip past unrecognized. Stay with me through all 5 of what I am about to share. Several of them are time-sensitive. Several of them are things your doctor will not examine unless you ask specifically. And at least one of them is something you can check on yourself right now in the next 60 seconds with no equipment at all. The first sign is clubbing. Place your hand flat and look at your fingers from the side. Take a moment to actually do this rather than simply imagining it. A healthy nail has a gentle outward curve, a shallow, smooth arc from base to tip. The fingertip itself is relatively flat when viewed from the side. And if you look carefully at the point where the skin of the finger meets the base of the nail plate, you will see a small angle there, a visible V-shape where the two surfaces come together. Clubbing is when that picture changes. Slowly, over months, the nail becomes excessively convex, domed, curving over the end of the fingertip like the glass face of an old pocket watch. And the fingertip itself thickens. The soft tissue directly beneath the nail swells and accumulates. The small angle at the nail base that I described begins to flatten and then disappears entirely. In more advanced cases, the nail wraps around the very tip of the finger, and the fingertip itself resembles something like a small drumstick, bulbous at the end. What causes this to happen inside the body? In certain lung and heart diseases, substances are released into the bloodstream that signal abnormal growth in the soft connective tissue at the tips of the fingers. The small blood vessels there, the capillaries, dilate and proliferate. Connective tissue swells and accumulates beneath and around the nail plate. The nail is gradually pushed outward and forward over time. This process can unfold across many months, even years, which is exactly why so many people do not notice it until someone else points it out, or until a photograph from several years ago makes the change obvious. The conditions associated with clubbing include lung cancer, pulmonary fibrosis, which is a progressive scarring of the lung tissue, chronic obstructive pulmonary disease in its more advanced stages, congenital heart defects present since birth that may have gone undetected or undertreated, liver cirrhosis, and certain inflammatory bowel conditions. None of these are minor findings. And what they share is this. In many cases, the clubbing arrives before the breathlessness, before the cough, before the fatigue, before anything the patient can point to and say, something is wrong. There is a simple test you can perform right now, and I want you to actually perform it rather than simply note that it exists. It is called the Shamroth window test. Press the nails of the same finger on both hands together, nail surface to nail surface, as though you are pressing two mirrors face to face. Look at the gap, or absence of gap, between the bases of the two nails where the skin meets the plate. In a healthy person, you will see a small diamond-shaped opening, a gap of light between the two nail bases. That gap exists because the healthy nail rises away from the fingertip at a normal angle, creating space when the two fingers are brought together. If your nails press together flush with no gap visible at all, the soft tissue behind the nail has expanded enough to push the nail forward and close that space. That result warrants a medical evaluation. It takes 3 seconds. It has real clinical accuracy. Do it now and then continue watching. The second sign is one that most people ignore for months, sometimes years, because it appears so minor, so easily explained away. A dark line, a narrow stripe, brown or black, running vertically along the length of the nail from the base to the tip on a single finger. Most people who notice this assume it is a bruise beneath the nail, or a remnant of something they cannot remember, or simply a quirk of their particular nails. Many people with darker skin tones live with these lines their entire lives, and they are entirely correct not to be concerned. In people of African, South Asian, East Asian, and Latin American descent, vertical pigmented bands on the nails are common and often completely normal. The melanocytes, the pigment-producing cells within the nail matrix, can activate and produce a pigmented stripe without any underlying disease process. This is well documented and must be said clearly so that people who have always had these lines do not read this section with unnecessary alarm. But there is a form of skin cancer called acral lentiginous melanoma that develops specifically beneath the nail plate. It is one of the more dangerous forms of melanoma, not because it is inherently more aggressive in its biology, but because it is so consistently mistaken for something harmless. It can look, for months and sometimes years, like a simple, dark line. It is found more frequently in people with darker skin, which compounds the problem, because the normal variant and the dangerous one can appear similar to the untrained eye, and the normal variant is correctly reassuring in that population, which can delay recognition of the abnormal one. There are 4 features that separate the benign pigmented stripe from the one that requires urgent evaluation. The first is width. If the stripe is wider than 3 millimeters, approximately the width of a matchstick head, that width requires evaluation. A normal pigmented line is typically very narrow and consistent throughout its length. The second is edge clarity. A benign line has clean, well-defined borders. The edges are sharp. A line with blurred or irregular borders where the pigment seems to fade or smear at the margins rather than stopping cleanly changes the picture. The third is color consistency. A normal pigmented stripe tends to be a uniform shade from base to tip. When the color within the stripe varies, areas of darker pigment, lighter pigment, or regions that look different from adjacent areas within the same stripe, that variation is a warning sign. And the fourth feature, which I consider the most important and the one that requires the fastest response, is whether the pigment has spread beyond the nail plate itself onto the surrounding skin of the finger. This spreading onto the cuticle skin or the lateral folds beside the nail is called Hutchinson's sign in clinical terminology. When that spreading is present, evaluation should happen the same day, not a routine appointment in several weeks. The same week at the very latest and same day if possible. If you have a dark stripe on a nail that meets any one of those four criteria, please do not wait to see how it develops. Things that are caught early in this category carry a genuinely different prognosis from things that are caught late. The third sign requires careful attention because it is easily confused with the harmless white spots I described at the beginning. The visual similarity is real. The clinical difference is significant. Horizontal white bands, not isolated spots, not random small areas of whitening at different positions on different nails. Bands. Complete uninterrupted lines running across the full width of the nail plate from one edge to the other, parallel to the base of the nail, and appearing on several fingers simultaneously at approximately the same position on each nail. These are called Mies lines, named for a Dutch physician who first described them in the early 20th century. They are associated with heavy metal poisoning, including arsenic exposure, with severe chronic kidney disease, and with significant protein deficiency in the body. The mechanism behind them is a temporary disruption of the nail matrix. When the body undergoes a significant systemic insult, whether from toxic exposure, from severe kidney failure, or from a period of profound nutritional deprivation, the nail matrix responds by briefly halting or disrupting its normal keratin production. When the crisis passes and production resumes, the abnormally formed section of nail has already been incorporated into the plate. It grows outward with the rest of the nail and eventually becomes visible as a pale horizontal band. Because all fingernails are growing simultaneously and all experience the same systemic disruption at the same time, the bands appear at the same relative position on multiple nails. That symmetry is what distinguishes them from trauma-related white spots. Trauma is random. You hit one finger on the edge of a table. You press one nail too firmly against the surface. The resulting white spots appear at different positions on different nails at different times and on different fingers depending on what happened. A systemic disruption is not random. It affects all the nails at once, and the symmetry of the resulting bands reflects that simultaneity. If you are looking at your nails right now and you are seeing what appears to be complete horizontal white bands crossing multiple nails at the same height, that pattern belongs in front of a doctor. Not because it is necessarily something catastrophic in your specific case, but because the body does not produce that pattern without reason, and the reasons that produce it are serious enough to investigate. The fourth sign is what I want you to pay particular attention to if you have been feeling more tired than usual, if you have noticed that your exercise tolerance has decreased, or if you have been told at any point that your blood counts are on the low side. Look at the surface of your nail plate from the side, in profile. A healthy nail curves gently outward, a gentle, smooth convexity from base to tip. The fourth sign is when that curve reverses. The center of the nail dips inward, creating a concavity, a hollow in the center of the plate. This is called koilonychia, and it is commonly referred to as spoon nails because in clear cases, the nail takes on the shallow bowl shape of a small spoon. The concavity can become pronounced enough that if you were to place a single small drop of water in the center of the nail and hold your hand steady, the water would sit there rather than running off. The primary cause of spoon nails is iron deficiency anemia. Iron is directly involved in the production of the structural protein keratin that comprises the nail plate. When iron availability falls, the keratin fibers do not stack and bond in the normal architecture. The nail loses its structural rigidity over time, and the outward curve gives way to an inward one. Here is what I consider the most clinically important aspect of this sign, and the reason I want you to pay close attention. Spoon nails can appear before iron deficiency registers on a standard blood test. The body protects hemoglobin levels in the bloodstream as long as possible. It does this by drawing on stored iron reserves in the tissues. The peripheral structures, the nails, the hair, the outer layers of the skin begin to reflect the deficiency first before the circulating blood levels have dropped enough to show on a panel. Your fingers are ahead of the laboratory. If you see spoon nails and you have had a normal blood test recently, that does not rule out iron deficiency as a cause. It simply means the deficiency has not yet progressed to where the standard measurement catches it. There is also a second cause that is less frequently discussed, but relevant for people who work with their hands in certain environments. Years of exposure to harsh chemicals without adequate protection, bleach-based cleaning products, industrial solvents, strong acids. These agents break down the molecular sulfur bridges that hold the layers of keratin together within the nail plate. When those bridges are progressively destroyed through repeated chemical contact, the nail loses its structural integrity layer by layer. Over years, the plate buckles inward. The concavity that develops from chemical exposure looks essentially identical to the concavity caused by iron deficiency. The cause is different, the corrective action is different, but the nail sign is the same. If you observe spoon nails on your hands and you have not had any significant chemical exposure, a complete blood count with iron studies is an entirely reasonable first conversation to have with your doctor. The fifth sign requires precision in how I explain it, because there are two very different explanations for the same visual finding. One is manageable with straightforward treatment. The other points to a failure of one of the body's most important drainage systems. Knowing which is which matters. Yellow nails. Nails that have shifted from their normal pale pinkish tone toward a deeper yellow, often accompanied by thickening of the plate and noticeably slower growth than usual. The more common explanation in older adults is a fungal infection of the nail called onychomycosis. The organism, usually a dermatophyte, colonizes the nail plate from beneath the free edge and works its way inward. As it progresses, it disrupts the normal keratin structure, the nail plate thickens, becomes discolored, may develop a chalky or crumbly texture at the edges, and separates slightly from the nail bed underneath. Most people first notice this on the toenails, which have ideal conditions for fungal growth because they spend most of their time in warm, enclosed footwear. I want to say something directly about fungal nail infection and diabetes, because this particular combination is not treated with nearly enough seriousness. If you have diabetes, or if you have been told that your blood sugar is on the higher end of normal, a fungal nail infection on your feet is not a cosmetic inconvenience to address eventually. Any breakdown in the skin barrier of the foot, any crack, any separation of the nail from the bed, any small wound at the edge of the nail becomes a potential entry point for bacteria. And in a person with impaired circulation in the lower limbs, which is common in long-standing diabetes, and with a slower immune response, bacterial infections in the foot can progress in ways that are genuinely dangerous. The clinical statistics on lower limb amputations and how many of them began with something that looked minor on the surface are not numbers I will recite here because I do not want to create fear. But I will tell you plainly, if you have diabetes and you have fungal nail changes on your feet, that is a same-week conversation with your doctor, not something to add to a future to-do list. Now, the second cause of yellow nails is less well known but important to recognize. Imagine a different picture from the one I just described. Not a single toenail or even several toenails, but all 20 nails on both hands and both feet, yellowing simultaneously, thickening noticeably, and growing at an unusually slow rate. This is not a localized fungal infection. And when this diffuse nail change is accompanied by swelling in the lower legs that does not resolve fully overnight, and by recurring respiratory problems such as chronic cough, recurrent chest infections, or persistent congestion, that combination has a specific clinical name, yellow nail syndrome. It represents a dysfunction of the lymphatic drainage system, the body's network of vessels responsible for clearing excess fluid, proteins, and metabolic waste from the tissues. When that system fails, fluid accumulates in the legs, the airways become congested, and the nail matrix, deprived of normal tissue drainage and nutrient supply, produces abnormally thickened, slowly growing, yellowed plates across all 20 nails. This finding requires a thorough medical evaluation. It cannot be treated with a topical antifungal preparation from a pharmacy. The nails in this case are not the problem. They are a signal from a system that is failing deeper within the body. I want to tell you about a patient I saw some years ago, because her story stays with me, and I think it will stay with you as well. She was in her late 60s, a tidy woman, health conscious, the kind of person who attended her appointments without being chased, kept careful track of her medications, and ate with genuine care. Her daughter brought her in, not because the patient herself was worried, but because the daughter had noticed something over the previous several months. Her mother's thumbnails had changed in shape. They looked fuller somehow, more rounded at the tip than they had been. The patient thought nothing of it. She had an active garden. She worked with her hands regularly. She assumed she had caught a nail on something, or perhaps it was simply the texture of nails changing as one gets older. Things change. That was the phrase she used when I asked her how long she had noticed it. Things change. She had no cough, no breathlessness on exertion, no unusual fatigue, or nothing she could distinguish from what she considered ordinary tiredness for a woman her age. Nothing hurt. No part of the story she told me pointed toward her lungs. When I examined her nails, I recognized early clubbing. The angle at the base of both thumbnails had narrowed. The Shamroth test showed a reduced diamond gap, not absent, but reduced. The soft tissue behind the nail plate had begun to accumulate. The changes were not dramatic, they were early. In a routine appointment, in the ordinary flow of conversation about medications and blood pressure readings and how she had been sleeping, these changes could easily have been noted and passed over. I referred her for pulmonary imaging. The results showed early-stage pulmonary fibrosis. The lung tissue had begun the process of scarring. At that point, the scarring was limited in extent. She was completely without symptoms. The disease had not yet declared itself in any way she could feel or name. She began a management plan at a stage when meaningful intervention was possible, when the options available to her were still real options rather than attempts to slow what had already advanced significantly. She told me at a later appointment that she had almost not come in, that if her daughter had not said something, she would have trimmed the nail and thought no more about it. That the idea of coming to a doctor because her nail looked slightly different seemed, to her, like an overreaction. I think about that word, overreaction, and I think about how many quiet signals are dismissed with exactly that word every day by people who are not overreacting, who are, in fact, responding correctly to something their body is trying to communicate. The overreaction is not seeing the doctor. The overreaction is waiting. If any of what I have described today sounds familiar when you look at your own hands, I want you to write yes in the comments below. Not because I will be able to respond to each one individually, but because it creates a record for yourself, a moment of acknowledgement. And because other viewers who read those comments and recognize themselves in them may be moved to act when they otherwise would not have. Now, I want to give you something practical and specific, because information without a clear path forward is not as useful as it should be. Once a month, examine your nails in natural daylight. This is not optional if you are taking this seriously. Natural light reveals color gradations, subtle shifts in tone, early yellowing, bluish or grayish hues that indoor artificial lighting masks entirely. Standard household bulbs distort color, and you will miss changes that are visible in daylight. Choose a consistent day each month, the same date if you can, so that you begin building a comparative timeline. Remove nail polish completely before the examination. If you wear gel coatings, remove them entirely at least once a month. An opaque coating can hide a process that is progressing beneath it for months. You cannot examine what you cannot see. Photograph each nail with your phone. Take the photographs in the same light, at the same angle, on the same day each month. Review them side by side. A change that is invisible from one week to the next becomes unmistakable across 6 months of monthly photographs. The camera gives you the comparative view that human memory cannot reliably provide. Run the Shamroth window test. Do it every month, not because you expect to find something, but because finding something early requires having looked consistently. The test takes 15 seconds for both hands. Examine the nail surface. Run the pad of a finger from your other hand across each nail. Feel for texture changes. Longitudinal ridges running from base to tip are common in adults over 60 and generally reflect the normal aging of the matrix, which begins to produce keratin less evenly over time. These are typically not cause for concern, but ridges that appear suddenly over a few months rather than gradually over years, or a single ridge that is dramatically deeper than the others, or pitting, small indentations pressed into the surface as though by a pin, these deserve attention. Nail pitting, in particular, can be an early sign of psoriasis, sometimes appearing years before the skin plaques that most people associate with the condition. Know which findings require evaluation this week. A dark stripe with any of the four warning features I described. New onset clubbing in a person who did not previously have it. Horizontal white bands across multiple nails at the same height. Yellow nail changes on all 20 nails accompanied by leg swelling or respiratory symptoms. These are not findings to bring up at your next scheduled appointment in 3 months. These are findings to call about within days. Know which findings are appropriate for a routine appointment without urgency. Early or mild spoon nails without other symptoms. Isolated yellow changes on 1 or 2 toenails without diabetes. Isolated white spots at varying positions on different nails. These are important to document and discuss, but they do not require you to call the office the same afternoon. 5 minutes, once a month. That is the investment. 5 minutes in natural light, with photographs and the knowledge of what you are looking for. I want to close with something that is not clinical advice. It is something closer to an observation that has stayed with me across 30 years of practice. The nail asks for nothing. It does not announce itself. It does not demand your attention. It simply grows, day after day, 4 months from matrix to fingertip, carrying in its structure the record of everything that was happening in your body during those 4 months. A fever you ran in January. A period of significant stress that disrupted your nutrition. A systemic illness that temporarily stopped the matrix from working properly. A slow change in the tissue behind the nail that began long before any other symptom appeared. All of it recorded, all of it present in the plate you are looking at right now. The body is not silent. It has never been silent. It communicates constantly through surfaces we see every day and have been trained to interpret as decorative rather than diagnostic. The nail is one of the most accessible of those surfaces. It requires no puncture, no sample, no appointment, no equipment. It requires only the willingness to look and the knowledge of what looking means. 5 signs. The dome that curves over the fingertip, the dark stripe that widens or blurs, the horizontal bands that cross multiple nails in parallel, the hollow center that curves inward, the thickened yellow nail that grows too slowly. These are not cosmetic observations. They are clinical ones. Some of them are urgent. All of them are worth knowing. The nail has been keeping your record your entire life. Every day, without interruption, without complaint, without asking whether you were paying attention. The only question now is whether you choose to read what it has been writing. If this was useful to you, subscribe to this channel. I release videos specifically for adults over 60 who want to understand what their body is communicating before it is too late to act on that communication. Leave a comment below and tell me, when you examined your nails while watching this, what did you notice? Your observation may be more important than you realize, and it may matter to someone else who reads it. I am Dr. Hiroshi Nakamura. I will see you in the next one.